Professor Sampoornam from the Department of Mental Health Nursing from Annai JKK Sampoorani Ammal College of Nursing, India. So it's a very nutshell presentation on esketamine nasal spray for depressive patients. So as you all know, for depression, we treat with antidepressants, and of course, some transdermal patches are available nowadays, like silicone transdermal patches we place for purely curing depressive symptoms. But currently, the scenario talks about esketamine nasal spray, which is really that too good for tapering the depressive symptoms. And here I am to talk about the same. Next slide, ma'am. Yes, introduction. So, ketamine can promptly reduce suicide and relieve other serious symptoms of depression. Esketamine Food Drug Administration approved is usually given as a nasal spray. It operates under S molecule. Ketamine can be administered intranasally, that is, spray into each nair of the nose for treating resistant mood disorders like depression. So basically, we treat depressive patients with all other drugs, and this esketamine nasal spray would be that too effective for treating or tapering depressive symptoms. Next slide, ma'am. Yeah. An initial clinical trial portrayed that ketamine curtailed the severity of symptoms in post-traumatic stress disorder. You'd have come across the abbreviation called post-traumatic stress disorder, PTSD, I suppose. And here I would like to highlight one more point. This PTSD has been pushed towards the medical surgical department rather than the psychiatry department. Why? In the sense, till 2017, they all, most of the scientists, they said that PTSD is purely related to psychiatry and psychic symptoms. And after 2017, many scientists opposed, and after regressive research and of course evidence-based practice, they all said that rather than psychic symptoms, most of the symptoms are purely related to medical conditions, and it affects most of the major organs or vital organs like heart, GA tract, even the lung. So I don't know how far, but still in psychiatry department we treat PTSD. So it is highly useful, and the investigation of the role of glutamate signaling in other illness may provide the impetus to develop novel therapies based on this pathway. Next slide, ma'am. Yeah, mechanism of action. Ketamine hits and targets N-methyl D-aspartate. It is nothing but NMDA receptors in the brain. So by binding with these receptors, ketamine increases the amount of neurotransmitter called glutamate in the spaces between neurons. So automatically, when it hits the NMDA pathway, the glutamate neurotransmitter will increase in the space between neurons, and which paves a great way for tapering the symptoms of depression or major depressive disorder. Next slide, ma'am. Intranasal administration. So we are here to talk about or see or read about intranasal administration. So administer half of the dose into each nair with the help of mucosal atomizer device or needleless syringe in the supine position. We can make the client or patient to just comfortably placed in supine position, and we can just make a spray into nasal nares. The total dose is equal to or less than 0.5 milliliter, which is administered into one nair. So onset of procedural sedation is 5 to 20 minutes, just 5 to 20 minutes. Okay, next slide, ma'am. Newer drug related to ketamine recommended by Food and Drug Administration, America. So FDA have granted approval of drug esketamine, a new prescription nasal spray for treatment of clinically resistant depression. So you should clearly understand the meaning of clinically resistant depression. So certain antidepressants will not work for a long-term clients or recurrent bipolar affective disorder. In such case, we can just put the patient for this esketamine nasal spray So this esketamine nasal spray again, it is an N-methyl D-aspartate receptor, and it really suits to taper the depressive symptoms. Next slide, ma'am. So clinical uses of intranasal esketamine could be number one, depressed mood and complex regional pain syndrome, transient hemiplegia, cluster headaches, major depressive disorder. Again, it can be called as unipolar depression or clinical depression, and pain, even postoperative pain. Next slide, ma'am. So commonly reported side effects associated with the intranasal ketamine could be constipation, drowsiness, lightheadedness, dizziness, nausea, unpleasant feeling of dissociation. So very commonly in clinics and clinical trial or clinical research work, we see nausea very common, lightheadedness very common, drowsiness and constipation is quite common. Next slide, ma'am. So precautions for intranasal ketamine. So precautions should be taken while administering ketamine nasal spray in conditions such as hypertension and schizophrenia, alcohol dependence syndrome, and raised intraocular pressure. See here in hypertension, you should understand hypertensive patients will receive antihypertensive drugs, again beta channel blockers and calcium channel blockers, and this calcium channel blockers will really interrupt with the intranasal ketamine action. So we don't put. And schizophrenia patients, mostly they'll have some problem with dopamine receptors D2 especially, that too in mesolimbic pathway, some mesocortical pathway or nigrostriatal pathway or tuberoinfundibular pathway. So we don't put this esketamine nasal spray. Rather, we put antipsychotics for schizophrenic clients. And alcohol dependence syndrome is also precocious. It can be considered as precocious for intranasal esketamine. And in raised intraocular pressure could also be one more precaution for intranasal esketamine spray. Next slide, ma'am. Yeah, future developments. So ketamine has also been studied and shown beneficial antidepressant effects when administered through oral, intramuscular, subcutaneous, sublingual, rectal, and intranasal dosage forms. The use of ketamine in depression has been uphold the research in the development of novel glutamatergic agents with a longer duration of action. Yeah, some previous back orally, intramuscularly, sublingually, they have tried much more. At present, intranasal doses are also available. Next slide, ma'am. Yeah, it is anticipated that the outcome of this research will yield faster and more effective agents for initiation, stabilization, and maintenance treatment of depression. Next slide, ma'am. So you should know about initiation, stabilization, and maintenance dose. So initiation dose will be put at the time of admission, and stabilization dose will be put later on, like tapering doses or a dose titration or increasing the dose. It is simply called as dose titration. And maintenance dose can be for a long time. So not more than 6 months, I suppose. Certain scientists, they recommend not more than 6 months because it may dissolve within 6 months. And again, if there is any relapse, we can put again esketamine nasal spray. So a critical research analysis here, there is a long paucity of information about other routes of administration for esketamine nasal spray. It certainly applies antidepressant effects when administered through non-intravenous routes such as oral or intranasal. Subsequently, scientists have examined the antidepressant efficacy of ketamine via intranasal or oral routes. Still, there is a debate between intranasal and oral route, but still, intranasal is also supportive for tapering the depressive symptoms. Next slide, ma'am. Yeah. In one study, intranasal ketamine 50 mg was compared with intravenous saline in a randomized double-blind crossover design involving 20 unipolar treatment-resistant depressive patients and 8 out of 18 complete in ketamine group who met the criteria after 24 hours compared with 1 of 18 in the placebo group. Effects persisted for 48 hours in post-treatment, just unimaginable, uh, in line with the durability of intravenous administration. So really it works by the statement we can observe. Okay, next slide. Hitherto, there have been no reports regarding a sustained efficacy for repeated doses of intranasal ketamine. Until 2020 approval of esketamine nasal spray for the indication, there was no approved medication for the emergency treatment of patients with major depressive disorder, that is MDD, or in need of rapid symptom control. Next slide. At 24 hours, patients in both treatment groups experience similar improvement in severity of suicidality. The safety profile of esketamine was further characterized in this study. Next slide, ma'am. So, conclusion. And research continues to decline the most effective role for ketamine in depression, and now its use might foster the development of similar agents with longer duration. Intranasal ketamine has been used by ketamine clinics for years and have had the same impact as intravenous ketamine, immediate effect with few side effects. So here they recommend esketamine nasal spray because of its own efficacy with very less and few side effects. So next slide, some of the references I've cited. So you can just go through all the references. Okay, so any doubts, any queries can be asked. Thank you so much for your patient listening. Thank you so much.
Yeah, sorry, I just had a question regarding the ketamine. So as far as I'm aware in Sydney, I think there's very limited, if any, like ketamine clinics, which I think she mentioned. I was just wondering, given that ketamine is really an emerging treatment, in patients who like come to these clinics, do they develop like a long-term tolerance to ketamine?
Sir, your question is about long-term tolerance, right?
Yeah, so over like months or years, do they develop any tolerance to the therapy?
Yes, I'll
Which
talk
might,
about. The thing is, your voice is interrupting me. That's why I couldn't understand your question. But still, I can address your question. The thing is, based on country, there, I think there is a multi-centric trial also for the same drug, and in animal research, it is quite successful. Preclinical trial, it is quite successful. Of course, in human being also, it is quite successful. And FDA has just recommended the same. And tolerance level can be minimal to my knowledge, and not more than 3 6 months. We don't recommend again. If there is any relapse alone, we just start again with nasal spray. It's a very short duration treatment, unless and until there is some what to say, relapse or some recurrent depressive problem.
okay, thank you very much.
Thank you. Thank you.
My question is, the ketamine is a psychotropic drug. By which mechanism it's antidepressant? By which mechanism? Is interact with dopamine or serotonin or adrenergic? What?
Yes.
By which neurotransmitter?
Yes. Thank you. Thank you. Glutamate. Glutamate.
By glutamate.
Yes. Actually, this drug hits it directly. It's N-methyl D-aspartate receptor, right, in the brain. This N-methyl D-aspartate further it triggers the level of glutamate. It increases the level of glutamate. Automatically, depressive symptoms will vanish away.
Okay.
That's the exact mechanism behind it.
Okay. Thank you.
Thank you. Thank you.
Thank you.
Dr. Sampoornam, I just wanted to ask, are there any levels of depression? Or if there are any levels, then at what level you know recommend this nasal spray?
So first of all, I would like to thank you for addressing such a beautiful question. So the thing is, yeah, you should understand there are 3 levels of depression: mild, moderate, and severe.
Yeah.
So for all the 3, we don't give. That's a specialty here. We talk about only resistant depression. Resistant in the sense, to some extent, what will happen? All antidepressants will not work out. What we give,
Yeah.
Like it could be like oral antidepressant, it could be like amitriptyline, nortriptyline, or any other anti depressive drugs. It could be even fluoxetine. It will not work
Yeah.
out. So why it is not working, that you should understand as a clinical uh, worker. So why it is not working in the sense, to after a period or after a while, what happens? Our brain will use that particular drug as a food. It will just eat and it will swallow off. So that is
Yeah.
that particular criteria, or that particular zone is called as drug resistant or drug resistance. So in such case alone, we put nasal spray. That's it.
Okay. Thank
Yeah.
you so much for
Thank
giving the
you.
answer to my question. And there's one more thing. Yes, the team member wanted to know if there is any side effects or precautions. I just got
Yes,
the question on here.
hmm. Side effects can be lightheadedness, quite common, lightheadedness, and of course, nausea, vomiting, it's quite common. Some headache also
Okay.
sometimes, some headache. And precaution can be for hypertensive clients and schizophrenic clients, alcoholic clients, we don't give at all.
Yeah.
And of course, increased intraocular pressure also, we don't put this drug.
Okay.
Mm, fine.
Thank you for addressing this question as well.